To learn more about this illness, joining us today is Dr. Christina Madison from Roseman University of Health Sciences. Dr. Madison, so great to have you with us.
Yeah, thank you so much for having me.
Of
My
course.
pleasure.
Yeah.
In China, they've done respiratory isolation. They've quarantined entire areas of the country. The size of New York State,
Yeah.
they've quarantined just really to try to stop the spread of the virus.
The world right now continues its fight against the Omicron variant. Joining us now to discuss the latest COVID headlines is Dr. Christina Madison. Dr. Madison, good morning. A pleasure to have you here on the National Desk.
A majority of people are asymptomatic, especially as we see breakthrough cases. And so this new emphasis on testing, I think, is just a combination of us learning more about how to mitigate the virus and how to really deal with these new variants.
Here to talk about the latest in the pandemic is clinical pharmacist specializing in infectious diseases, Dr. Christina Madison, who is the founder and CEO of the Public Health Pharmacist, a public health consulting firm.
So vaccinations, masking, ventilation, and testing. So those are the four main things that we are worried about right now that are really going to help us with getting through this pandemic. So first and foremost, I want to tell you that I have gotten my own child vaccinated. And so I have a 5-year-old son who just recently completed his Pfizer dose. So I was super excited about that over the weekend.
COVID cases sparking a renewed conversation about what it will take to end the years-long pandemic. Joining us now to discuss the latest coronavirus headlines is Dr. Christina Madison.
We do need to do a better job of vaccinating the global community because that's really what's going to help us to stop all of these variants.
Is there any risk at all if we are outside walking, hiking, that we have a higher risk of transmitting this?
Yeah, no, at this point, those things are safe. Just making sure that you are practicing that 6 feet apart from another person. But those are things that are definitely going to be good for your mental health and your overall health.
But not all masks are made equal. And so even if you are wearing a what we call a consumer face covering or a cloth face covering, really what you should be looking for is to make sure it has multiple layers. So that's per the World Health Organization.
Even when we had people who were eligible, they may not have known where to go to get access to the appointment, right? So I really do think that it comes down to access and then being able to educate and getting those campaigns out to those communities of color.
Well, Dr. Madison, first and foremost, let's talk about the news today. Johnson & Johnson releasing their vaccine. What does that mean for the vaccination effort?
Oh my goodness, it's such a game changer for us that are out on the front lines providing this vaccination. I will tell you, we have a task force that meets every week at Roseman, and we do a debrief and we basically do a postmortem and we talk about what things went well and what things didn't. And we continue to evolve and do constant quality assurance every time we have a vaccine event at our university.
Dr. Christina Madison is part of Nevada's enormous effort to administer the COVID-19 vaccine. She's with Roseman University, a point of dispensary, helping with their vaccination clinics, and she's doing this all as a volunteer.
This is basically my Super Bowl. So there was no way that I wasn't going to step up and be there to be part of this.